Today we're going to talk about how to reverse shoulder problems, how to stop and reverse shoulder pain, shoulder discomfort. Um, in my last video, I touched on how our bad posture can contribute to shoulder problems, and you need to fix your hip alignment in order to help. But some of the shoulder problems are actually attributed to neglected muscles attached to the shoulder, directly attached to the shoulder, obviously. What's going on is through years of our lifestyle, our athletics, our labor, sitting and relaxing, just doing all kinds of stuff, we tend to move our shoulders forward, rotate them forward, to, throw, push. We just have them kind of slouched forward, or we kind of tend to use some muscles a lot more than other muscles. Take, for instance, the biceps. We have quite a few muscles attached to the shoulder, the biceps, the triceps, three deltoids, front, side, and rear, and then the trap muscles, and then the rotator cuff muscle. So sometimes a lot of people get big bulky biceps, or strengthen their biceps too much and completely neglect the triceps. You'll see a lot of weightlifters, or guys will have big bulging biceps and then they'll have nothing in their triceps. That's not what you want to do. That's going to cause joint shoulder problems. You have to balance your muscles and address the weaker, neglected ones, like, take for instance, the deltoids. We will lift stuff up or push stuff using our front and side deltoids, or raise stuff up over our head, but we will never use the rear deltoid, to pull our shoulder back, or our arm back. That creates stress in the joint and then the nerves and the connective tissue, that imbalance. You've got to address the neglected, weaker muscles that you rarely, if ever, use. Now I'm going to attempt to let you hear me set my shoulder. What happens is, like I said in the first video, in order to maintain proper hip alignment, you have to keep your legs sucked up into the socket real good, by exercising, strengthening your core on an ab lounge. Well, same concept here. In order to keep your shoulders in their sockets, your arms need to be pulled up into the sockets real good. You need to make sure your arm is jammed up into the socket. And you do that by strengthening the neglected muscles, like the rear deltoid. And try not to use your front and side deltoids anymore. Trap muscles, we don't use those very much, but we'll use our chest muscles. That's another muscle connected to our shoulder, our chest. We use that all the time. And we never use the trap muscle that pulls against it. So what I'm going to do is attempt to reset my shoulder and allow you to hear me reset my shoulder. I'm going to strengthen some of my smaller, lesser used muscles, like the triceps, the rear deltoid, my rotator cuff. I'm going to rotate my forearm outward towards my back, and I'm going to use my trap muscle, strengthen the trap muscle, flex the trap muscle. It's best to have resistance to do this stuff, but for the sake of just being pragmatic, I'll just do it without resistance, and I'm not even on supplements either. So it's good to use supplements, pre-workout supplements, nitric oxide boosters, growth hormone booster, testosterone booster, strong supplements like that when you're fixing these weaker, neglected muscles, in order to pull harder against the big, overly used muscles. So I'm going to get a little closer and try to help you hear me reset my shoulder and suck my arm up into its socket better. First, I'm going to rotate my rotator cuff muscle, rotate my forearm outward. Then I'm going to pull the shoulder up using my trap muscle. Then I will flex the rear deltoid pulling my arm back, and then I will flex my tricep, extend my arm. So here's the rotator cuff. Let's see if we can hear it. I'll rotate it out. There was a little snap. Now I'm going to use the trap, I think. Didn't hear much there. Now I'm going to try the tricep. That one seems to help a lot, the tricep muscle. So I'm going to extend as hard as I can. There's a little snap. And not only does it suck this shoulder up into its alignment better, it also sucked my right shoulder up. So my non-dominant side, and that's the thing too. If you're dominated by one side of your body or the other, if you're not ambidextrous, it's probably the weaker side of your body, the non-dominant side of your body. You're going to need to flex more often. You may not even have to flex the other side ever. But we did the trap, tricep, rotator cuff, and now I'm going to try the rear deltoid, see if I can get some more better alignment by flexing my rear deltoid. Yep, hopefully you heard a little snap there. And as you can see, it jammed my shoulder up into its socket better. It's pushing my shoulder up towards my trap muscle too, pulling against the chest muscle. So overall, it just, sucks your shoulders up better into their alignment. Now, like I said, that's a lot of the problems are in those muscles directly connected to the shoulder. That's where a lot of pain is going to come from. But also, your posture is going to contribute too. You must fix your posture. I would start with the posture, because that is what's going to push both your shoulders up, push against your chest muscles, gives you a good, posture, keeps your shoulders up. I might even be able to, flex some muscles right now and try it. We'll try the external oblique. A little twisting action to fix my posture, and then this shoulder comes up a little. My dominant shoulder comes up, gets jammed up into its socket. I can feel the trap muscle. It's more conducive to the trap muscle. The back muscle, the shoulder blade, my shoulder is sucked up, and it's easing the stress that I put on my the muscles around my shoulder blade, the connective tissue. A lot of times people will have, kind of a burning sensation in their shoulder blades. This helps it. This stops it. When your shoulders get sucked up into their socket better, like that, it eases that stress on the connective tissue and the muscles right there. So that is how to correct shoulder problems. Best done with resistance and dumbbells or something, maybe a pulley and strong supplements. Also, get my book to learn exactly how the precise relationships between your muscles and nerves and bones. You've got to learn the basics in order to build on those to prevent all joint problems, hip problems, almost all forms of chronic pain. It starts with muscle balance. You've got to learn the relationship between your bones, your bone alignments, and nerves and muscles and connective tissue. That's where it's at. Get my book, Eliminating Pain, Your Guide to a Better Lifestyle, and learn all about it. We have a 100% success rate using these techniques. Even people who mildly use these techniques get relief. And you can imagine when people go all out 100%. I'm having people routinely get relief from their problems. And, they're back to feeling great. No supplements, no products, except for some weights and an ab lounge. That's it. One-time investments. You don't have to be addicted or dependent on pills, creams, ointments, drinks, supplements, pills, prescription drugs, none of that junk. Just solve the core problem and overhaul your diet. Diet does contribute to a stronger, tighter body. That's a good chunk of it, but not the majority by any means. So get yourself on a good diet. My other book, the Diet and Nutrition Super Manual, How to Lose Weight, Gain Weight, and Be Perfectly Healthy, goes into all that. How to eat clean and kind of restore your body back to the way it was as a kid. That's the point in all of this, to restore your health back to the way it was as a kid. And this is how it's done, the natural, perfect, holistic way. No manipulations, just reversing all the stress we've been putting, getting nutrients in your diet, getting all the nutrients your body needs to perform well, and fixing muscle imbalances. So I don't know what we're going to do next time. Maybe next time we'll go into elbow. Maybe we'll go into elbow pain or something like that, tennis elbow. There's a few ways to help bad elbows and stuff. So that's it. Subscribe. Stay tuned for the latest and greatest. Hit me up, The Body Mechanic, on Facebook. www.letmybodygo is the website. Just stay tuned. Stay tuned as much as you can for the latest and greatest in good health. We got good things coming down the pike. Just stay tuned.